You're watching New York's #1 news. Channel 7 Eyewitness News.
Well, next in Eyewitness News, summer means more time in the sun.
The life-saving advice that no one should ignore, including people of color.
I think it's fair to say that a lot of people associate skin cancer with spending time in the sun, but that's not always the case.
No, it's not. And just because you have darker skin doesn't mean skin cancer is something you won't have to worry about. In fact, you can get skin cancer in some of the most unsuspecting places. Dr. Sapna Parikh is here to explain. Sapna.
Well, if your skin's a little darker, people often think, I can skip the sunscreen, but you can't. And also, there are other causes of skin cancer besides the sun. So even if your skin is like mine, it's possible.
It looks like you healed so nicely.
Earl Jolly had skin cancer on the right side of his chin. Were you surprised?
Yes.
It's true, the darker your skin, the less likely you are to get skin cancer. But it's possible. Dr. Khorasani is chief of dermatology surgery at Mount Sinai Hospital. He's seen an increase in sun-related skin cancers, especially among the Hispanic population.
I think a lot of my Hispanic patients feel like because they have a little darker skin, they shouldn't use sunscreen.
Eddie Vakili is Iranian and also has a darker skin tone. She's had cancer on her scalp and ear, which Dr. Khorasani says may have been related to sun exposure.
I didn't know that because, my skin is not that white.
But many skin cancers have nothing to do with the sun, but are instead caused by genetic changes or even HPV, the human papillomavirus.
By far the most common skin cancer in African American is HPV-induced squamous cell carcinoma.
And that's why it's important to look for skin cancer even in places where the sun never shines. Like the sole of the foot, the tip of the toe, or even under the nail. That dark line is melanoma. Overall, melanoma is deadlier in people of color. The 5-year survival rate for African Americans is 77%, compared to 91% for Caucasians. That's thought to be because it's detected later.
A lot of people often think that they have a bruise that is not going away, or they got a splinter.
So the message is if you see changes on your skin, have it checked out regardless of the color of your skin. And I know one reason people don't have things checked out often is if you don't have insurance. At Mount Sinai, they offer surgery for skin cancer for free every Thursday. I posted the details on Twitter at Dr. Sapna ABC7. David and Sade, back to you.
That's great information to know.
So important.
Okay.